Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiener.
And I'm Dr. Paul Zalzal.
Today, Paul, we're going to talk about a very interesting topic. Like most of our topics, actually pretty interesting.
Depends who you are.
Yeah, it depends who's watching. Some people are like, yeah, not interesting at all.
Right.
What's the best brace for my knee?
Right.
I have arthritis of the knee. I'm thinking about getting a brace. What's the best brace? What kind of brace should I get?
We put them on our teeth.
Yeah.
Why don't we put them on our knee?
What some people do.
Okay, so let's talk about different types of braces there are.
Yeah.
Okay, there's your soft braces.
Okay.
They're not even really braces. They're like sleeves.
Yeah, they're called braces, but yeah, I agree.
Yeah, they're sleeves. They might have a little bit of thicker material on the sides.
Yeah.
They work a lot by compression, minimizing swelling,
Right.
and proprioception to a certain degree. Proprioception is your body's way of knowing where your limbs are in space, right? And I've heard some of the proprioceptic feedback you get from wearing a brace helps with arthritic knees.
And I have a lot of patients who say, hey, I wear this,
Yeah.
It doesn't seem like it's much, but it really helps me. And I'm like,
It's probably the copper or the magnet in it. Topic for another video.
That's right. Okay, so then the next level of brace would be something that has maybe some metal in it. Some little metal bars on the side, whether they're hinged or not, whether they're rigid. Something that's kind of that next level of constriction. Usually as braces go from soft to custom, they usually get a little bigger, a little bulkier, a little more rigid, but often as that happens, they get more benefit for you. So it provides some side-to-side stability for you. In a hope of reducing your pain.
Right. So this is gonna augment your ligaments and keeping your knee stable. And some of these hinged braces that are not custom even try and unload a joint to a certain degree.
Right.
A more rigid type brace, hinged brace, that kind of. That's probably your next step up.
Yeah, and you can usually get those at pharmacies, home health stores.
Sure.
Yeah, lots of different options.
Okay, so you got the soft sleeve,
Yeah.
you got the bit more rigidity with some hinges maybe, but just sort of one size fits all or three sizes fit all. And then the next level I think is a custom brace, a custom fitted brace.
Right, so the first thing that is important to know about the custom braces is that they're expensive. Full disclosure, they're very expensive.
Custom in the word of anything, it becomes expensive.
Cabinets.
Custom home.
Custom home, custom cabinet.
Yeah.
It's expensive.
Custom car.
But what does that mean, custom? Like, what is it, like, custom, what does that mean?
Well, it means someone came around and took measurements of your knee.
Yeah.
And then used those measurements to either manufacture, design, or fit a brace that is going to fit your knee much better.
And as you're sitting at home, if you look down at your knees, you recognize that your leg is a different size than other people's.
Yeah.
You'll notice that your alignment is different, so you may be bow-legged, you may be knock-kneed. So the brace has to, A, take that into account, and then the purpose of the brace, you have to determine what the goal of the brace is. So what's the purpose of like a custom unloader type brace?
Well, there's custom braces, some of them are unloaders, so what they try and do is unload the arthritic side of your knee. 9 times out of 10, it's the inside of your knee that's arthritic, so the medial side. So the unloader brace will try and unload the medial compartment to try and load the lateral compartment where you don't have as much arthritis. 1 time out of 10, it's your lateral compartment or the outside of your knee that has the arthritis. So you'll have a lateral unloader brace to try and unload the lateral compartment.
Right, so in someone who's bow-legged or has varus alignment, the purpose of the brace is to try to push from the outside to try to make you relatively more knock-kneed. To get the weight over on that outside compartment that actually isn't doing very much and actually usually has really good cartilage. We see that a lot when we replace knees, when we scope knees. One side's really bad and the other side sometimes looks almost pristine.
Yeah. Now, other applications of these braces, you may not have arthritis, you may have a ligament tear.
Right.
Okay, so an anterior cruciate ligament
Torn
tear.
ACL, for sure.
Right, or a collateral ligament tear, MCL, LCL. Sometimes those are, custom braces can help those injuries as well.
Yes, for sure. What would you say is one of the big obstacles to a custom brace? Like, why do people say, I don't want a custom brace?
Expensive.
Okay.
Cost.
For sure, cost is number one.
Yeah.
Number two for me is sort of like, how am I going to wear this? I got to wear pants, or I got to go to the office. I don't like how it looks. It's too bulky.
Yeah. Well, that's like any treatment has its side effects or negative effects, right? Every time we prescribe a treatment, if you take a pill, you could have a side effect from the pill. If you have a surgical procedure, you can have a side effect from the procedure. So the side effects of braces are, one, you may not like the way it looks. You may get a little bit of skin irritation where the brace is touching your body, and it may not work for you.
Right. And then another thing is some people say like, well, how often do I got to wear it? Do I got to wear it all the time?
I tell them to wear it when they're up and about.
Yeah.
Right? oop and a boot. Because if they're sitting around, you don't need to wear the brace. When you go walking, or when you're going to work, or you're going to golf, or whatever it is you're
skiing.
into. Skiing.
I have some patients who wear them for skiing.
Yeah.
And what I tell people too is that it not only will reduce your pain during that activity, but often, at the end of the day, you've had a long, hard day, you sit down, you're like, oh, my knees are sore. Often it can reduce that pain because your knee has not been loaded in the normal way.
It's the gift that just keeps on giving.
Keeps on giving. So in general, would you say that braces are worth considering, Paul?
Yeah, I definitely think, because it's a low risk treatment.
Yeah.
There is some evidence to show that bracing does help. And logically, especially in a ligamentous injury, bracing helps prevent further ligamentous damage, or prevents a joint from subluxing, or going in and out of joint if you have really loose ligament or a severe ligament injury. So yeah, definitely I often suggest some form of brace.
And I think the best brace for you is A, one that you can afford, B, one that makes your joint feel better, and C, one that you'll actually wear.
Yeah.
So if it's going to sit in the closet, it doesn't matter if it's $19,000. If you're not going to wear it, don't get it.
But at the end of the day, if you're really saying what is the best brace,
yes, I think the custom unloader, if it's for arthritis.
Yeah, a ligament brace is a custom brace for arthritic knee, a custom unloader brace. That's the best.
Yeah.
If you're not looking at cost, if you're looking at effectiveness.
Some people do write in the comments, hey, you didn't actually answer the question.
That's exactly why I just said that, because people often put in the comments, you didn't answer the question. We're answering the question. A custom brace is the best.
Some people got really frustrated with the topical one where we didn't name a brand.
Sorry.
Topical. Sorry,
we never do that.
We're not really allowed to endorse
brand. We don't endorse. We don't get paid by companies to do this stuff. We don't get paid. We just do it.
That's right. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.